Doctors in rural hospitals anywhere in the world often face extreme challenges: limited resources, remote communities, and high stake cases. With 2 fellowships, Dr. Ishani Nanayakkara specializes in multiple competencies, providing critical care across Western Australia and Queensland's most remote regions. From emergency medicine and pediatrics to anesthesia and Indigenous health, she mentors future doctors and champions community-centered healthcare. We explore her experiences and insights next on Kaleidoscope Life Dialogues. But let me ask you, you've spent so much time in rural hospitals. What's it really like working with those remote communities?
I find it very rewarding and very challenging. Of course, I give my whole heart when I go into the remote bush. We call it the bush Outback, and my areas of work is all I say fly in, fly out doctor, where I need to fly to these rural areas. My areas are stretching from Western Australia to Queensland, northeast Queensland. And in Western Australia, I work mostly in Derby, in Fitzroy Crossing, and Kununurra. And these are very remote areas. Other extreme of travel is to the rural North Queensland. For example, Palm Island, where it's Indigenous community. It's an island where they need Indigenous expertise. They pretty much have to deal with trauma, violence, mental health, and chronic diseases. Those are specialities. In Western Australia, in Derby, they don't have many pediatricians, so that's where I give my best as a pediatrician when it comes to, they don't have, where I can give my skills in neonatal resuscitation when there are unwell newborns.
Indigenous health has been a major focus for you. What have you learned from working closely with the Aboriginal and the Torres Strait Islander communities?
For anyone, a doctor or any medical personnel or anyone to do with Aboriginal communities and Torres Strait Islanders, we need to have that cultural awareness is very important. And also having the respect is very important. And also the trust is the most important. I'm from an Asian country, and they accept us with more warmth, and they appreciate us very much coming all the way to help them. And that building of trust is not an issue. Being from an Asian country, Sri Lanka, we are very well recognized. They love us. Based on their cultural heritage, based on their stolen generation issues, their mental health is very sad. It's really, really traumatic background they have. And based on that traumatic setting, there is so much of mental health which is also associated with alcohol, drugs, trauma, violence, and then tribal differences when they come together. So you have to be aware of all this when you go into different communities, and that's the most challenging part. And in Arakoon, there are different tribes, and when I went there, I got my assignment for a few weeks, and I realized there's so much pathology I can learn. Things like syphilis, sexually transmitted infections, all the tropical diseases, the things that you don't usually see in a Caucasian population or in a metropolitan region was first my eye-opener. I really loved the pathology, and I thought this is a great place for me to learn.
Most people would love to go into metropolitan settings.
Yeah.
Why did you choose to go into the remote areas and do your work?
One thing is the opportunities that I get. So unlike I work in a metropolitan, which I have worked in the tertiary hospitals as a pediatrician, and I've worked in the neonatal ICUs in intensive care units in the metropolitan areas. But when I got the exposure to work in the rural remote areas, I find I get the opportunity to do more things, such as an emergency doctor, the things that you don't get in that opportunity in a tertiary hospital. But when you go rural, you have no option. You are in the deep blue sea. You have to do it, and like putting intense, chest drains, and intubating patients, all trauma that you get exposed to. You have to do it. You have to stabilize a patient before you send the retrieval team, request the retrieval team to transport them by air, by chopper. So this was, and I really felt I want to keep upskilling myself, and that was why I chose outreach, the Outback.
Chronic diseases need ongoing medical care. You are a fly-in, fly-out doctor. How do you ensure that that ongoing care continues?
We are expected to manage them, even chronic diseases, in that specialist, on that specialist level we have to manage. So the only time we reach out is when, for example, patients with diabetic, which has gone into extremes of chronic kidney disease, needing dialysis, needing kidney transplant. In such situations, then we reach out to the specialist and liaise with them in order to have them assessed and for further care. Until such time, we as rural generalists, we manage them. So whenever we have difficult cases, difficult scenarios, complex cases, it's not just one chronic disease, it's a mixture of everything, then we kind of have a telehealth consult together as a team management. One other thing is we have the thing called GP management plans. It's called general practice management plans that are done in most practices, and that helps screening and managing patients every 3 months, making sure they come, they followed up, their blood, they're just brain followed up so that they don't fall out of the system.
What is the biggest challenge you have in working with rural communities?
The distance. For me, I have to travel thousands of miles. For me to go to Western Australia, it takes 3 flights, and then I drive another 250 kilometers, which I'm happily doing it, and it's an opportunity for me to see the country as well. It is the remoteness, and sometimes you're on your own. That's the biggest challenge. And when you go into these different hospitals, sometimes it takes a while for you to understand your teams. You need to know what resources we have and the strength of each person, because all those things very important, especially when you're on night on call. If there is a trauma, you need to know what resources, people you can help. You need help.
So you've worked in very high pressure areas like neonatal intensive care in emergency. Has there been a moment or a case that has stayed with you?
When I worked in pediatrics and I was requested to retrieve a baby, which was in a rural remote setting, and I was sent on a chopper in the middle of the night and to a rural remote hospital where there was no helipad, and my only escort was the paramedic and the pilot and the little globe trotter that we have to carry with us to transfer the sick newborn. The biggest challenge was there was no landing, and the paramedic had to have a beam light to reflect down to lower the chopper before we got off to make sure we had a safe landing. And that was one of my first encounters, which I never forget. And of course, I have to stabilize the little baby before we transported back the baby on the Globetrotter again.
Being Sri Lankan, has it helped in your work? Do you take bits of culture and heritage with you, given that you work in these rural communities? Are there similarities?
Always, I'm so proud to be Sri Lankan. I always say I'm Sri Lankan because it is important, and I feel there is a lot of respect for us Sri Lankans in Australia. We have a reputation, and our reputation is cricket. So when they can't say my name, they relate to Sangakkara because I'm Nanayakkara. So that's another thing. And so the cricket and our food. Our food is It's to, and I love cooking. Well, that's one of my passionate hobbies, pastimes. Being Sri Lankan, we have that empathy. Our Sri Lankans are born for kindness, and it reflects when we go, and it shows, and people appreciate it very much. And whenever they ask me where's my primary education, I say I'm Sri Lankan, and my basic medical education was in Sri Lanka. The cake was baked in Sri Lanka, but the top of the icing was from Australia.
Kaleidoscope is everywhere on YouTube, Facebook, Instagram, and LinkedIn. Follow, like, and subscribe to stay connected.
You focus on your goals. We will take care of the risks. Silly Life.